Really excited to have Dr. Thais with us today. As you may know, she recently joined our practice. I'm really proud to have her as a part of our team. She has a wide range of expertise that are all very relevant in the domain of whole person care. And I'll sort of touch upon a few of the domains and then have her introduce herself as well. But yeah, Thais is an amazing human being and practitioner. She has a background in internal medicine, integrative medicine, palliative care, psychedelic therapy, brings in wisdom from Eastern medicines, from indigenous Amazonian type medicine, and the Western approach, integrating it all into a holistic offering. Really, the skill set covers all the way till end of life, but certainly relevant for earlier on in life as well. Thais, I'll let you introduce yourself a bit, and then we can have a conversation, and I'll pose some questions as we move forward.
Hello, everyone. Good morning. Thank you for your presence, being here, and the opportunity to share. So yes, I'm Brazilian American, originally from Brazil, and this interest and this call for whole person care has been since that's what actually brought me to medicine, first of all, and integrative medicine has been on my path and my pursuit since actually before getting into medical school. As a child, interested in plants, interested in spirituality and in world religions and like the origins and the ancient old times medicine. So yeah, it's been quite a route to come all the way here, and it's I feel that as I grow as an individual, I'm growing too on my skills and practices and offerings to really continue to expand the the sense of like how I connect with my patients and beyond them, but also their families and how this balance of like health and illness in the full spectrum of life is how to support them through different phases. Yeah.
Thank you
So
so much. Thanks. That's it's really awesome to learn about your journey. You did medical school and then you did internal medicine training, and then came to the U.S. You did a second residency in internal medicine, is that correct?
so the story, the moving, how I got here, it started as actually very intertwined again with integrative medicine. I was studying, like in Brazil, acupuncture is also a medical specialty. You can actually get board certified, and I am in acupuncture. And that was I did that, and also alongside with integrative medicine residency. So I had these two worlds in my life there, started a practice, but I just couldn't really understand. Like I wanted to see more how like out there was this intersect, this combination and this communication between practicing both. So that's what brought me to actually UCLA Center for East West Medicine, and that was 2017 first, and it was like a very natural place to like where I found so many mentors and support. And that's where a place where I grew a lot. It came first as like a short time, month away, and then it turned into like a whole life transition, which actually I came and worked with them for a couple of years before I started my other internal medicine residency here at UCLA. So yeah, so the integrated medicine brought me actually to the US and to learn more, to expand my lenses. In California, just such a spiritual and like multicultural place. I was very just felt very much of like a great matching and support for expanding and exchanging with what I had learned from Brazil too. And that's also a piece of personal history that the reason I came for integrative medicine, and one big piece of what I stayed is that I actually found my husband here. Wasn't part of the plan to move, but it happened, and so the two things, medicine and love, brought me here to stay.
Great. Well, we're thankful to your husband for being part of the path to keep you here. I'm curious what led you to do palliative care as a fellowship and to do this work in palliative and hospice care.
So, in palliative care, I feel like everything that I'm doing has so much intersection because since the palliative care is the most holistic specialty we have in medicine, it really works with like seeing the person as a whole. It brings back spirituality as like the center and brings back the patient to be the one like valuing so much the patient's um like personal life, insights and priorities, and it really brings them at the center and the care team around as a support to find them, give them the best life and quality of life. And so that was like a one big piece of like why palliative care, like, and then in the other it was well, I had a person a very close personal loss, which is my dad, my first year of medical school actually. And it really shaped my sense of like what it means to take care of not just the patient, but their families, and to see when medicine sometimes feels like maybe giving up or saying there's nothing else to do when there's actually so much to be given, to be supported, and just seeing like again and again like the intersection, the overlap of like just how medicine can often see like death as a failure, not like part of a cycle and part of a transition, and honoring that and bringing that, yeah, just, so really this piece on and like my constant request for like how can I be the most holistic and like seeing on my care lenses brought me to palliative care, and also just as integrative medicine is beyond what I can do, but it's a very collaborative space that I'm work where I'm like, and there is a lot of just interwoven interdisciplinary spaces, right? So I feel like I'm very like flexible. Sometimes I'm acting more like a what do you expect of a doctor talking about drugs, but at the other time, if the like, but at the same time, as the need and pretty much always like playing almost a role of a chaplain into some sense of like talking about spirit, like that deep existential crisis that it's so interconnected with how the whole body is feeling, and then like all the emotional aspect. So you're constantly navigating different like a what I sensed was like the origins of medicine before the Cartesian split between mind and body. It was like the doctor was really the like the healer, or like going back to like shamanism. It's like it's that medicine women, men with at the same time like that spiritual role in the community, and understanding that emotions and feelings are felt and held in the body, and the body has so much wisdom to tell, and the body speaks as well as the mind.
Yeah. Thank you. Thanks for sharing that personal note of loss. And, I actually really resonate with that. My journey to palliative care also has to do with loss and really to medicine. I lost my mother as a young child, so I had no vivid memory of her loss, but I always felt that void, and sort of more on a subconscious level was led to medicine and ultimately to whole person care and palliative care. And I really resonate with what you shared. Um, it's true that in the Western medicine paradigm, especially, there's a bit of a stigma against this sort of practice. In our society, really, death has been pushed to the side. And when I explain the specialty of palliative care to people that aren't familiar, I always sense this awkwardness when I try to explain that, it's not just about saving the life, but it's about maximizing the quality of life in whatever time remains. And I think unless someone has had the experience of loss, of what sort of difference it can make to care for people the way that we do as palliative care practitioners. And like you said, palliative care is a very multidisciplinary field. Until someone's had that experience, it's hard to appreciate the difference one can make, even though we may not be prolonging a life. But to give that positive experience, or as positive as possible for the patient, for the loved ones at the end of life, is extremely profound. And with that comes the notion of healing versus curing. And the way we teach, actually, we teach this in medical school at McGill, this difference between healing and curing, and how you can help someone heal without actually curing their illness. And I'm wondering if you have any reflections on that, and how you view it.
Absolutely. So, like healing versus curing, in the sense that medicine has a large focus on curing or fixing, and that comes from like that feeling of like the body as some sort of machine that needs to be fixed. The doctor as the mechanic that takes something out or puts something in, and then it turns into functioning again. And if it doesn't, it's a full loss, and that's it feels like, or the mechanic is not good, or creates all this dynamic. Meanwhile, like um healing, like even the word comes from the origin of the words healing comes from wholeness, and it's just seeing this person as a full integrated being, and connected with nature, connected with community, and as a soul, as a spirit. And healing comes coming from the sense of wholeness, actually. And the other word that comes from it is actually holy, again, the sacredness of like feeling whole back again. When there is an illness, there is a disruption on the sense of wholeness, the sense of like, and there's this fragmentation. And what I see on the place where integrative medicine is stronger is, and it's in this place of like supporting, finding whole again, finding whole, and which means finding, like, can be, even if there is no, like, finding a meaning and an understanding of out of what's going on. It is about like seeing this as seeing this individual as a whole person with a whole story, and how to support their own capacity to reconnect with their pieces, putting their pieces together. And the role of that's why I really connect us to this name of like just being like the doctor being like a gardener. Like I'm supporting this person. I'm using, like, knowing that like the capacity and trusting that the capacity is within it. It's not like I'm not the one fixing the garden, I'm tending the garden, and actually nature is the one that's bringing wholeness. It's from within. So that's where, like, there's always healing is always possible, even when like curing, it's not seen as it for medicine. So bringing that like support and holding hands, and caring for the person as a whole. And yes, and final thought is that sometimes curing can happen uh, even without without um, healing, and and still the person may feel like the cancer was cured, but they still don't feel healed. There's still like this like state of like loss, state of confusion, state of the pain that can remain when actually they were like maybe treated or seen, or they feel like they had a piece taken out. They're not their selves anymore. So the other role of like integrative medicine is supporting this integration of the mind, body, and spirit, even when like fear actually happened.
Thank you. For sure. I mean, it's so common that patients, especially cancer patients, have gone through the treatment. They're technically cured, but they're still suffering. This is something that obviously we see all the time. And I think one of the reasons research shows that palliative care is beneficial for cancer patients is this holistic approach to healing. And I think it's no surprise that cancer patients with early introduction of palliative care end up actually doing better in the course of their treatment. And of course, this is an area that needs more research. But from my experience, it can have not only that they live longer, but that they probably have a higher quality of life, regardless of the trajectory of the disease. One of the things I'm curious about is if you compare attitudes towards death, let's say in Brazil, compared to North America, the US, do you find it's a similar Western type attitude towards death, or do you see a difference out there in society, in medicine?
There's a lot of shared like perceptions still. I feel like we do have in Brazil a lot of this influence of America. And as a very like Christian country, there is it is a mix. Like there is still, I sense like an understanding and a hope for many people that there is some sort of continuum that can bring some sense of peace. And there's also this growing, I sense this actually growing sense of like the death as the separation and the distance of death, and seeing as something that wasn't meant to happen. I wish I could say different. I was just there for like this year for a month in the hospital, and I found more similarities than differences. I sense on the on yeah, on that, maybe to some level, like here, because of there's so much more resources, what I see is like that sometimes there is a like a prolongation of the state of like when there's maybe even the doctor, everyone's sensing that they may be causing more suffering than doing good. And it's, which was another reason why it brought me to palliative care, like can we pause and reflect about what we're doing? And so I sense there is more because of more resources here, and over there that like this stop moment would come earlier because like you wouldn't go that far. Yeah, I yes, so that's pretty much.
Thank you. Thanks. I want to shift gears a bit towards indigenous practices as we sort of pivot more towards psychedelic therapy. Brazil, obviously, a large part of the Amazon is in Brazil, and there are a lot of indigenous practices there. I'm curious if you can talk about your exposure to that sort of culture growing up in Brazil, and if you've had any experience with that.
So like I'm from the like southeast area. The interesting is about indigenous medicines is that like particularly the ayahuasca being like this spiritual, the use of as a psychedelic substance in a very ritualistic space is very much part of indigenous culture, but also has moved to the cities like in the early 20th century. So there are centers around the city also, like in like bigger cities. So it's around. And there's also like communities that relate with different indigenous tribes and invite and have the opportunity to have like a shared knowledge space. So this is something that it is legal in Brazil, and being part of the like the use as a in the context of religious or spiritual space. And personally, like that was something that I had earlier in my life too, and it's part of my path to palliative care and to just to support in my path in integrative medicine and psychedelics was to have the connection in a very traditional space too, with in both actually in this syncretic mixed of like syncretism religious with ayahuasca and like in the city like space more close to the urban space, and also with it as like a part of like a more traditional space. And I found that was definitely it is there is a I wish I could say that things were more like there was more of a, like a acknowledgement and respect of this the traditional indigenous medicine in Brazil. It is growing. It is a subject of like more attention over the last, I would say, 10 years or so. But there's still a big of a separation. Like I would say, in between the medical field, there is still like a not seeing it as like a not necessarily like a healing tool to be incorporated or something. It's more like it's more individuals that go to the for personal calls or personal connections, and then a full communication between like the medical space and the indigenous wisdom. It's something that it's growing, but it's still not very like established. It feels a little bit of like niches, separate niches.
For sure. Yeah, I think this allopathic medicine, wherever in the world it's practiced, does have a huge separation with sort of indigenous practices, with psychedelic medicine. And a lot of the research with psychedelics for this palliative and end of life population is with psilocybin. Um, so I think we need to have more studies with things like ayahuasca. When I was at the ICPR conference in the Netherlands, there was a study out of Spain, a really brilliant researcher in Barcelona who had done this study providing ayahuasca assisted therapy for grief. And they had this amazing setup in a retreat space where different people who had lost loved ones participated in this ayahuasca therapy ritual. And it's important to say that our use, at least the paradigm that we like to practice with psychedelics, is really indigenous informed. And so they use that sort of therapy, which is indigenous informed, but it includes psychotherapy. And they had amazing results. That's the type of healing that we talk about, where, obviously, let's say losing a child is the kind of trauma that you can maybe never fully recover from, but your relationship to that loss is certainly able to change and evolve. And perhaps this continuity of being that many report while having psychedelic experiences is something that can be really beneficial for people after a significant loss like that. So yeah, I am hopeful that we can bridge the gap. I often talk about the first patient in Quebec who got permission to use psilocybin. Her treating team for her cancer treatments was against using psilocybin. So unfortunately, we were never able to treat her. And she passed away without having the experience of the psilocybin sort of journey. And the stigma in the medical system is real, and it's up to us to educate and to advance the research so that we can have this offering I'm wondering, from your experience as a palliative care provider, how do you see psychedelic therapy benefiting patients through their sort of journey?
So I sense I want to share one personal piece too that like definitely my experience with like ayahuasca in this space of like groups and community and what felt like was very supportive for me and actually brought me to the sense that I could actually do this work with being constantly facing and supporting patients with dying was this sense of like peace and acceptance around death that comes from seeing life beyond and seeing the sense of like that mystical, so named in research, mystical experience of this lived experience of seeing the body as like this energetic being that lives beyond this lifespan, and being able to have this experience of like feeling connected with loved ones and with my dad in my case. And this all brought me to that not deep knowing of like this is such a like a healing space, such a healing like support for patients for just like struggling with their grief or just or of this anticipatory grief of their own losses, and which can be early on their illness and also their loved ones. And so that's where I see the role of psychedelics in palliative care, particularly for this deep existential dread and fear of what comes after, or how like and also just like that sense of like feeling lost and feeling like you're dying and you don't have the energy or the direction, or you're lacking like meaning and understanding of like what to do with life. So I sense it's a very supportive um, tool to use alongside, like again, like it's a very relational tool too, right? To use to help people to face and terminality or face like just the impermanence of life at any time. It can be from like the big loss of the final one's death, but all the other losses that we go through life, and making supporting this acceptance of the impermanence of it by seeing something greater than that. Mhm.
Exactly. Yeah, it makes me reflect back to Dr. Tony Bossis, who's one of the researchers in NYU where they did the psilocybin randomized controlled trial for cancer patients. And some of the highlights of their findings was that patients who were benefiting from this therapy, they were sort of experiencing meaning making and transcendence. These were two of the qualities that really helped patients with their suffering. So that makes a lot of sense. If we think about integrative medicine now, like, I think it's clear for most people now that, lifestyle is a really important factor in well-being for the average, human being. Obviously, what we eat and what we do and how we feel is very instrumental in our health. I'm curious if you can explain a bit how integrative medicine could help the patient population that's dealing with serious illness or even closer to the end of life. Perhaps just talking a bit about integrative medicine, what it is and how it can be applied.
Yeah, so integrative medicine is there. It's focused on finding with one's own like individual needs and doing a holistic assessment that includes about like what are you eating, how you're sleeping, balancing between like uh, movement, exercise, and also rest and mindfulness, and how are your relationships, and all of this is like the foundation of what it means to find like health in a more holistic space. And even when there is like a serious illness that maybe there's an expectation to be getting worse, like those foundations can really help like support this capacity of the body that to refine as much as possible this dynamic balance and this flow of energy. That so it's integrative medicine is so much support for helping on both all of this of like educating and teaching, finding one's own like needs and how to support one's nutrition and one's own sleep, and bringing in the mindfulness practices. Like integrative medicine, it's this like being open to everything that it can support the patient and beyond like just pills and drugs and like this Western maybe lenses of what medicine is. And it's also embracing it. It's having putting on my internal medicine hat too, and knowing about all the drugs and the full potential of it when it's indicated, and knowing also the complementary ways to support that. And one way that I particularly practice and use is using this traditional medicine, Chinese medicine lenses with the practice of acupuncture, which can help with very much like all that those symptoms that may come with an illness, from like pain, nausea, fatigues, insomnia, to help refine that balance and also guide nutritionally of like about this own patient with this own imbalance, and connecting with that and seeing how can we nourish this body in this on the physical realm with food, and on the spiritual realm with like thoughts and reflections and emotional support. So those are like layers of integrative medicine. So it's like seeing the person, like individuals' needs, supporting their own capacity of healing, and it's very much centered in the relationship. That's often a missing piece of like how much like healing is full presence, how much healing is a deep listening, and this as also a key ingredient of integrative medicine, this relationship.
Thank you. Yes, I mean, I find myself, sometimes I'm stuck in this position where I can't help the patient's need. I can prescribe some medications, but sometimes, actually, oftentimes, the patients are already so heavily medicated, from the cancer treatments to other symptomatic medications. They're just tired of taking medications. And that's where I think it's amazing to be able to offer, other tools that have less side effects that could be truly beneficial. And I think that's where integrative medicine is so key. And my practice in Canada, we don't have as much integrative medicine incorporated. I find like in a place like California, especially, there's a lot more of that being practiced. And it was very eye-opening for me to attend the Society for Integrative Oncology conference recently, and to see how much work is being done, how many studies are conducted with mindfulness, with acupuncture, with other supplements, especially like Chinese type supplements. So it's really awesome to explore this world more, and to be able to have this offering for patients. So,
Definitely reflection on the it's such a space, and with pretty much no side effects, particularly acupuncture, for so it can really reduce that pill burden and reduce that side effect that come from a side effect from trying to treat a side effect. So, and more than that, like again, we were there at the conference. It seems like there is an infinite number of research coming out for acupuncture from like all stages, from like doing treatment as a way of like helping with the immune system, and then with all the side effects that may come after, for example, neuropathy, and so much that it's like we don't have much more like medicines even to support, or they are just like not well tolerated. And it's not wonderful if we can like support like this. Again, acupuncture is not about, and it's about activating the body to so that the body can bring its own like homeostasis and support whatever it needs, not too much, not excessive, not too little. So
Yeah. And I mean, I'm not particularly against the use of medicine. I think medicine is really useful. But I find that a lot of patients are just over medicated and over medicated according to their own desire. They're just like, I don't want more medicine. One of my mentors in palliative care, Dr. Dworkin, who was a pioneer in the space, he was telling me that when he talks about medicine to patients, he sort of explains it as a symphony, and there's an orchestra, and each medication has its role. And I often use that, and I think it's helpful because people are tired of it, but sometimes they really need a medicine to have an effect and another medicine to counter the side effect of the first one, and it really becomes a symphony. And you can find a balance a lot of times, but it's nice to have other tools like acupuncture. And obviously, a lot of people can't access acupuncture or not fit enough to be able to sort of receive these services. And one of the things that I found really interesting in this recent conference was acupressure and how self acupressure can have tremendous results. So I'm wondering if you can talk about acupressure and yeah, how it can be used.
yeah, and I think that like the lenses of like Eastern medicine is about like a lot of teaching and education, and acupuncture is one that is like you go there and you can to receive acupuncture, but then you do your work at home, which includes the acupuncture, maybe include qigong, movement, mindfulness, movement exercises, and so acupuncture, like you're asking, it's about like stimulating the acupuncture points with like pressure. You can do your hand pressure. It's doing like a self massage, and some like common ones and good. Well, usually often uses like for example this one in your hand that you can press. It's like it's related to a meridian that goes all the way to our head, and actually can help with like headaches, like jaw aches, and there's other ones, for example, here on the wrist that have been studied to help with nausea, which is such a difficult side effect from like nausea, from like chemo or from surgery. So those are like yeah points that you can use to activate, and it's part of like again the connecting with the body, stretching the body, and stimulating it.
Yeah. And one of the ones I was surprised about was the use of it in fatigue. So, cancer fatigue is a very common problem. And usually what we offer is things like stimulants, which are used in ADHD, or wakefulness agents. And they had some really interesting data to support using self-acupressure as a way to combat cancer fatigue, which I think is amazing.
That is great, yes. And also there's some, yeah, in some herbal medicine in Chinese medicine, especially the ginseng that was well studied also for cancer-related fatigue. So it's another part of the which you can use as a tea or as a pill. But that's another one too. And yes, it's just like you can put the needles, or you can also just like pressure, massage as a way to stimulate. So empowering again the patient. I think that's a good key piece of integrative medicine. It's about being like a teacher and supporting one's own skills to care for themselves, or their caregivers teach them. Yeah.
Yeah. I want to pivot a bit and talk about a subject that we discussed earlier, and it's something that I found fascinating. and that is a subject of dreams. And obviously, with psychedelic therapy, we're creating these experiences that are often dreamlike. There's a lot of overlap. And one of the things that one of my other mentors in the hospital, Dr. Chang, talks about is, to ask patients about their dreams, especially as they approach end of life. So I'm wondering if you can talk a little bit about that. And I know that's something that you're interested in. Would love to learn more.
Yes, I definitely am fascinated on this topic, and particularly working with, I also work with hospice, so I see often and follow patients towards their last months, weeks, months of life, and it's such a common report of like night dreams, vivid dreams that are different than just the regular dreams. They just feel real, more real. And the actually daytime visions, they're like in between, like the patients are awake, but they're seeing visions. And they're usually, for most of the part, very comforting and different than what we call like delirium, or like, which are all often like something uncomfortable, restless, that doesn't make sense. Those are visions of that are often related to the theme of traveling and to connecting with loved ones. So I recently had a patient who who actually had advanced dementia, wasn't talking for some good time, but then approaching his end of life, he would see his mom in the room, and he would see his dog who had passed away on his lap, and would be talking about packing. And that's so this history, and between many others, of another patient seeing like Virgin Mary and saying that she's in heaven, and all this stories, and sometimes in the full dream state, sometimes in this like in between, seem to be bring a lot of like sense of like comfort and meaning creation for the patient and for their loved ones who are around. And there's actually some good research showing that it actually reduce like the chance of prolonged and complex grief for their caregivers. And it's a sign of like just a peaceful dying. It's more like that this patient is just going to have a restful end of life. So, and so for me, this is like having that sensitivity to ask and be present and acknowledge that this dreams, and validate them, can be such a healing support for patients and their families. And what I sense that psychedelics do is that actually, like as this dreamlike state seems to happen naturally, we can actually create them and bring them into maybe an early stage, an early phase of life, as a tool, as a support to for like dreamlike states and the materials to work through and find support someone's find meaning out of that space. And similarly, the two are talking about like, it seems that it's all about this traveling and this experiencing of seeing loved ones, which is very commonly reported and felt on psychedelic experiences too, or seeing spiritual figures. So that's an area that I'm very fascinated. And there's also one more study about like there's one study that was about like meaning-centered dream work for patients on hospice. Was about like, so, and showing like very positive outcomes of talking through those experiences, either like awake or asleep visions, as as material to support patients on this phase of life. So that's where it's like my next domain that I'm really working on expanding my skills. It's on meaning-centered psychotherapy, and deeper work on the and deeply studying like Jungian and psychology as ways of supporting my patients and bringing this question of have you been having dreams, and validating and bringing this as part of their care support.
Thanks. Yes, I mean, I know that in a lot of the sort of older psychodynamic psychotherapy, they really valued dreams as a window to the subconscious. in a very similar way that we view psychedelics as a window to the subconscious. Just to sort of pick up on what you said, so you mentioned that there was a study showing that um, having the patient having dreams resulted in less prolonged grief for the caregivers. Is that what you said?
Yeah. So having that shared experience so the family can like witness often this shared dream or the shared like more often like vivid lucid dreams like visions near death awareness visions can actually support the caregivers and the rationale is that it just brings a sense of peace that like because those visions are often like comforting and are often showing that the loved one is well accompanied and it's literally preparing for a traveling is going on a journey. It's like the packing, saying like, "Oh, I'm packing," or I'm like getting my getting on my train. Those are themes that I've actually heard patients saying. So it's and so I talk through with families and like really again the normalizing and more than normalizing and like supporting them like reflect so where do you think he's going and where is this place that he's talking about and then stories come up like oh I think that's where he grew up or like oh his dad used to take him on the on this trains and it's like wow so it's like and then having that conversation with the family really creates a sense that transforms this phase of life from something truly like maybe like a sad grief and farewell to like almost like a mystical experience of like wow this is and this all state of like oh there's something that transcends what like I can see there's maybe another something after it's a continuum.
Amazing. Yeah, I don't routinely ask my patients about their dreams, but I remember the times that I do, patients are first very surprised. Like, oh wow, my doctor is asking about dreams. What's going on here? But it's often very interesting, when you get into that sort of conversation that's beyond the ordinary. I feel like it has this healing effect for patients to be able to express parts of their experience that is normally fully ignored by Western medicine.
Or even pathologize, particularly visions. I've seen often like if you don't address the family can get distressed and the care team gets distressed. Oh, they're seeing dead people, or something like that. But it depends on like it can be a delirium, yes, or can be if it's comforting for the patient, if it makes sense for them, then like my sense that we don't need to suppress that. It's and there may be something naturally occurring. And there's many theories of like near our death that may be a sort of like natural DMT release, which is the same as the ayahuasca, or there may be even like some and similar and like NMDA receptor antagonists going out because the descriptions of like particularly ketamine experiences and the overlap with like the descriptions of near death experiences are so similar. There's actually a substance that it's again one study showing that between all psychoactive psychedelic substances, ketamine is the one that has the most overlap with the descriptions of near death experiences of people who actually had those. So maybe there's something that it's happening naturally in our body as we are preparing for dying. And I see the use of psychedelic assisted therapy as a way of like bringing those experiences in an earlier time so you have more time to prepare and integrate. Yes.
Yeah, it's very fascinating, this overlap between near-death experiences and psychedelic therapy. Extremely interesting. And a colleague of mine, Dr. Evan Lewis, who's a neurologist, we were talking about that sort of overlap from a neurologic perspective, and that's something that we'll delve into in a future webinar. So I'm really excited about that. So some may know that I actually have a master's in nutrition, and I really value the benefits of food as as medicine, as a tool for well-being. And I'm curious if you can talk a little bit about like how you can use food, let's say in this patient population, to manage their symptoms and to improve their life.
Yes, I love talking about food and diet and ways to support it. There's often a lot of like this changes in like that can happen in our body and just like so adapting the food to whatever illness is coming in and how the body is feeling can be very healing. And the way like I see nutrition, it's that well we are of nature, made of nature, and food is our connect one of the ways that we connect with the nature within ourselves. And Chinese, like Eastern medicines in general, they take nutrition so as an energy and also as energy to some level. It's like some foods may have more like heat and other foods are cooling. Some foods are particularly nourishing for like this, what we call qi or vital energy, something that moves, that keeps us like warm and energized. So often on like serious illness, there is a lot of like depletion on this cheap energy, and there may be like there is often this imbalance between the heat and the cold, the dryness and the dampness, and then helping patients get in touch again with how their bodies as like as part of nature, as made of all these elements of and seeing like what are actually the nutrients or like what are actually the groups of substances that can help your body refine this balance. If it's too cold, maybe we need to warm it up. And what are the warming up herbs that we can, or spices that we can add to your diet? And what are the main, like, if like the energy is so low, how can we support your body to create energy to like tea nourishing foods? So those are, so like knowing what a patient eat is and using just natural food and the way to cook as simple guide tools of how to make that body that maybe is going through some serious illness, has less resource, take the most out of the food and the energy. So one simple example is about like just like warming up foods and how like again in this general sense when the body is depleted, like giving like raw foods, it's maybe not the best because just some extra work for the body, but it's so like giving some guidance around that and to help like digestion, to help the energy, something that I love talking about. Of course, very individual, just giving some general like taste of it. That's something that it's part of the of this integrative assessment and approach for care.
Yeah. Thanks. Yeah, I'm actually Iranian myself, and in the Persian culture, we're really into the hot and cold nature of foods and what we consume, and everyone's always like analyzing, is that too much hot? Is that too much cold? And to balance it all out. I find it really fascinating.
Yeah.
So thanks for that.
People studies are coming out from it. It's so funny because like for Western lenses, like it's so hard to capture that. But like for example, like there's traditions like oh warm chicken soup seems to be good for a flu. That's been something that like it's been recommended for colds in Chinese medicine for a long time. And now they did a study like, hey, yeah, actually reduce the phlegm and reduce. And I was like, wow, it's fascinating. So I love it.
Very cool. Do you recommend supplements in general to patients? Like you mentioned ginseng, but do you recommend other supplements ever?
Yes, I think I see there is some there's good medicine there. There is some good supportive supplements. it's also always a balance. I think it's very individual approach. I use supplements in some way as like medicines and drugs too. It's like, what are we doing, using it for how long, and what is the benefits? And they they can partner together. And I that's something that I like doing, like discussing with patients and going through the ones, maybe which ones they already have, or what is their relationship with supplements, how they want to support their health, and discuss the options too. Like, can we go through supplements, or can we work through food to get those, like focus on those foods to get those similar nutrients, or what feels like feeding for that individual.
Amazing. As the session comes to a close, um, one of the things you mentioned is movement. So it's very interesting. So Qigong, as a very interesting modality, I've tried it a few times and I find it really powerful. I think as we enter end of life, it seems that we're more and more bedridden, and I think even the smallest amount of movement can go a long way. And to combine movement with mindfulness is a really powerful tool. And so that is something that you recommend to patients as well.
Of like starting my visits either with like a mindfulness phase, with Qigong as movement practice or not. It's something that feels with, yeah, it's just such a great, like, again, self-care and teaching tool. And being well studied too for all sorts of like cancer related side effects, including and in pain. And it's something that it's completely related with Chinese medicine and the use of like the regions and energy to flow, because the foundation of Eastern medicines is that like illness and pain and comes from like stagnation or an imbalance. And the stagnant, and what movement does is to help with the flow of whatever is stagnant. And our body loves movement. And like you said, we tend to do less and less and less. And we're not talking about like running, exercising, which it's about just like the gentleness of like the opening of your arms and the closing and the going to the up and down, as little as that, with the intentionality and with the mindfulness. It's very supportive for the body. Our body loves movement.
Great. Thank you so much, Dice. It's so exciting to have you join the practice. And I look forward to working together and offering our services to those in need. Do you have any final words to share?
Thank you all for being here and your time and attention, and just excited to be, yeah, helping more people and supporting your community and finding health and wholeness.
Great. Thank you, Thais. That was really wonderful. Have a great day, everyone, and we'll be seeing you soon. Thank you. Cheers.